Question 1. A nurse is caring for an elderly patient diagnosed with Parkinson's disease. The patient exhibits rigidity, tremors, and bradykinesia, making it difficult for the nurse to assist with activities of daily living. Adults. Which of the following strategies would be most beneficial to help improve the patient's mobility and comfort? A. Encourage the patient to ambulate without assistance to promote independence. B. Provide frequent small meals to maintain energy levels and reduce the need for mobility. C. Assist the patient with gentle stretching exercises and recommend the use of assistive devices. D. Reassure the patient that mobility will improve as the disease progresses. Answer. C. Assist the patient with gentle stretching exercises and recommend the use of assistive devices. Explanation. Parkinson's disease leads to motor symptoms such as rigidity, tremors, and bradykinesia, which significantly affect the patient's ability to perform EDLs and ambulate safely. The most appropriate strategy to improve mobility involves assisting the patient with gentle stretching exercises to increase range of motion and recommend assistive devices, e.g. walkers or canes, to enhance safety and independence. Encouraging ambulation without assistance. Option A is not advisable due to the high risk of falls. Providing frequent small meals. Option B is useful for general nutrition but does not directly address the patient's mobility issues. Reassuring the patient that mobility will improve. Option D is not appropriate as Parkinson's disease is a progressive condition. Symptoms typically worsen over time. Question 2. Mr. Daniels, a 45-year-old male with a history of type 2 diabetes, arrives at the clinic for a routine checkup. His blood pressure is 150/92 mm Hg and his blood glucose levels are higher than usual. He expresses difficulty in managing his condition due to a hectic work schedule and lack of motivation. As the nurse, which of the following interventions would be most effective in supporting Daniels' management of his diabetes? A. Educate Mr. Daniels on the importance of regular blood glucose monitoring and adjusting medications as needed. B. Refer Mr. Daniels for psychological evaluation to address his lack of motivation. C. Encourage Mr. Daniels to engage in strenuous exercise program to improve his blood pressure. D. Discuss the possibility of initiating insulin therapy to better control his blood glucose levels. Answer A. Educate Mr. Daniels on the importance of regular blood glucose monitoring and adjusting medications as needed. Explanation. Effective management of type 2 diabetes relies on regular blood glucose monitoring, lifestyle modifications, and medication management. Educating Mr. Daniels on the importance of monitoring his blood glucose and adjusting medications based on the readings is a fundamental intervention to help him manage his diabetes more effectively, while referring for a psychological evaluation. Option B may be useful if there is significant depression or other underlying mental health issues. The immediate focus should be on diabetes management strategies. Encouraging an exercise program. Option C might not be suitable due to his current health status and needs to be tailored to his capabilities. Initiating insulin therapy. Option D is not necessary at this stage unless his blood glucose is severely uncontrolled despite other interventions. Question 3. Scenario. Mrs. Williams, a 67-year-old female with a history of chronic obstructive pulmonary disease, COPD, is admitted to the hospital with increasing shortness of breath. Her respiratory rate is 24 breaths per minute, and she is using accessory muscles to breathe. Mrs. Williams is anxious and expresses difficulty in catching her breath. What is the priority nursing action in this situation? A. Administer oxygen as prescribed to improve oxygen saturation levels. B. Encourage Mrs. Williams to breathe deeply and slowly to promote relaxation. C. Administer a bronchodilator to relieve bronchoconstriction. D. Increase the frequency of monitoring vital signs to assess respiratory status. Answer A. Administer oxygen as prescribed to improve oxygen saturation levels. Explanation. In this scenario, Mrs. Williams is showing signs of respiratory distress, which could be indicative of an exacerbation of her COPD. The priority nursing action is to administer oxygen to improve her oxygen saturation levels. Oxygen therapy is crucial for COPD patients experiencing increased shortness of breath or hypoxia. Encouraging deep breathing, option B, may help with anxiety but does not address the underlying respiratory issue. Administering a bronchodilator, option C, is appropriate, but the immediate priority is to ensure adequate oxygenation. Monitoring vital signs, option D, is important, but the immediate action should focus on stabilizing respiratory status through oxygen therapy. Question 4. A nurse is caring for a patient recovering from a stroke. The patient has right-sided weakness and has difficulty with speech and swallowing. The healthcare provider has prescribed a speech therapy evaluation and recommends a soft food diet. The nurse is concerned about the patient's risk for aspiration due to the swallowing difficulties. Which of the following interventions would be most appropriate to reduce the risk of aspiration? A. Encourage the patient to eat quickly to ensure they get enough nutrition. B. Place the patient in a sitting position with the head of the bed elevated to 90 degrees during meals. C. Administer medications for anxiety to reduce the patient's discomfort when eating. D. Allow the patient to eat on their own to promote independence. Answer. B. Place the patient in a sitting position with the head of the bed elevated to 90 degrees during meals. Explanation. For patients with swallowing difficulties, maintaining an upright position during meals is critical to reduce the risk of aspiration. Elevating the head of the bed to 90 degrees helps facilitate swallowing and prevents food or liquid from entering the airway. Encouraging the patient to eat quickly, option A, is dangerous because it may increase the risk of aspiration. Administering anxiety medications, option C, might help with discomfort, but it does not address the physical issue of swallowing difficulty. Allowing the patient to eat independently, option D, could be unsafe if the patient is unable to manage their swallowing properly without supervision. Question 5. Mrs. Garcia, a 32-year-old woman, is diagnosed with major depressive disorder and has been prescribed an antidepressant. She is also currently taking a medication for chronic hypertension. After a few days of taking the antidepressant, she complains of dizziness, nausea, and a slight headache. Upon further questioning, the nurse learns that Mrs. Garcia also consumes 2 cups of grapefruit juice each day. What is the most likely cause of Mrs. Garcia's symptoms? A. A side effect of the antidepressant medication. B. A drug interaction between the antidepressant and the grapefruit juice. C. A result of her chronic hypertension medications. D. An underlying issue unrelated to her current medications. Answer. B. A drug interaction between the antidepressant and the grapefruit juice. Explanation. Grapefruit juice is known to interact with several medications, particularly those metabolized by the liver's cytochrome P enzyme system. Many antidepressants and antihypertensive medications are metabolized through this system, and grapefruit juice can inhibit the enzymes that break down these drugs, leading to higher drug concentrations in the blood. This can increase the likelihood of side effects such as dizziness, nausea, and headaches. Option is incorrect because while the antidepressant may have side effects, the patient's symptoms are more likely related to the grapefruit juice interaction. Option C is unlikely unless a hypertension medication specifically interacts with grapefruit juice, which is not common. Option D is also incorrect as the symptoms correlate with medication interactions rather than a separate health issue. Question 6. A nurse is educating a newly diagnosed diabetic patient on the importance of foot care. The patient expresses concerns about not feeling pain in their feet, particularly after stepping on a sharp object. What is the best explanation the nurse should provide to the patient? A. You may have injured your foot without realizing it. It's important to inspect your feet regularly for wounds and ulcers. B. You are not at risk of foot injuries as long as you avoid stepping on sharp objects. C. A lack of sensation in your feet is a normal part of aging and has nothing to do with diabetes. D. Pain in the feet is often a sign of something serious, but not feeling pain is nothing to worry about. Answer A. You may have injured your foot without realizing it. It's important to inspect your feet regularly for wounds and ulcers. Explanation. Diabetes can lead to diabetic neuropathy, which affects the nerves in the feet and results in reduced sensation or loss of feeling. This means that a patient may not be aware of foot injuries, such as cuts or blisters, that could lead to infections or ulcers if not treated promptly. Option is correct because it emphasizes the importance of regular foot inspection to catch injuries before they develop into more serious complications. Option B is incorrect because even if the patient is cautious, they may still suffer from unnoticed foot injuries due to the lack of sensation. Option C is incorrect because neuropathy is a common complication of diabetes, not a part of normal aging. Option D is misleading as it downplays the importance of careful foot care in diabetic patients. Question 7. Mr. Thompson, a 70-year-old male, has been prescribed warfarin for atrial fibrillation. He is seen at the clinic for routine follow-up and reports occasional bruising and slight nosebleeds. Which of the following actions should the nurse take next? A. Instruct Mr. Thompson to stop taking warfarin immediately and report to the emergency room. B. Check Mr. Thompson's most recent inner level to assess his anticoagulation status. C. Reassure Mr. Thompson that bruising and nosebleeds are normal side effects of warfarin. D. Administer vitamin K to reverse the effects of warfarin. Answer: B. Check Mr. Thompson's most recent inner level to assess his anticoagulation status. Explanation: warfarin is an anticoagulant, and patients on warfarin therapy need to have their international normalized ratio inner levels monitored regularly to ensure they are within the therapeutic range. The symptoms of bruising and nosebleeds may be indicative of excessive anticoagulation, which can lead to an increased risk of bleeding. Step is to check Mr. Thompson's inner to determine if his anticoagulation status is appropriate. Option is unnecessary unless the inner is dangerously high. Option C is incorrect because while bruising and nosebleeds can occur, there could be signs of over-anticoagulation and further investigation is needed. Option D, administering vitamin K is only appropriate if the inner is excessively elevated, which has not yet been determined. Question 8. A nurse is caring for a 50-year-old female patient with hypertension. The patient reports taking her antihypertensive medications regularly but is concerned about the side effects. She states she feels lightheaded and dizzy when standing up quickly. Which of the following is the most appropriate nursing intervention to address the patient's concerns? A. Instruct the patient to increase the dosage of her medication to see if it resolves the dizziness. B. Advise the patient to rise slowly from sitting or lying positions to prevent dizziness. C. Reassure the patient that lightheadedness is a normal part of the aging process. D. Recommend that the patient stop taking her antihypertensive medications to eliminate the side effects. Answer: B. Advise the patient to rise slowly from sitting or lying positions to prevent dizziness. Explanation: orthostatic hypotension, a common side effect of antihypertensive medications, can cause dizziness or lightheadedness when the patient transitions from a sitting or lying position to standing. Instructing the patient to rise slowly from these positions can help prevent sudden drops in blood pressure and reduce dizziness. Option is incorrect because increasing the medication dosage could worsen the side effect. Option C is incorrect because lightheadedness in this case is more likely due to the antihypertensive medications, not aging. Option D is also incorrect, as stopping the medication without consulting the healthcare provider could result in uncontrolled hypertension and more serious health issues. Question 9. A nurse is providing discharge teaching to a patient with chronic kidney disease CKD. Here's beginning hemodialysis. The patient expresses anxiety about the procedure and asks about how hemodialysis works. Which of the following statements should the nurse include in the teaching plan? A. Hemodialysis uses a machine to filter waste products and excess fluids from your blood when your kidneys can no longer do it effectively. B. Hemodialysis involves using medication to dissolve waste products in your blood, which are then eliminated through the urine. C. Hemodialysis will help your kidneys fully recover and restore normal kidney function over time. D. Hemodialysis is a one-time treatment after which your kidney function should improve dramatically. And so A. Hemodialysis uses a machine to filter waste products and excess fluids from your blood when your kidneys can no longer do it effectively. Explanation: hemodialysis is a procedure in which a machine filters waste products, excess fluids, and toxins from the blood when the kidneys are no longer able to perform this function due to kidney disease. Option A accurately explains how hemodialysis works. Option B is incorrect because hemodialysis does not rely on medication to dissolve waste. It uses a filter. Option C is incorrect because hemodialysis is a treatment for CKD but does not restore kidney function. It helps manage the condition. Option D is also incorrect because hemodialysis is typically long-term treatment, not one-time procedure. Question 10. A nurse is preparing a patient for a surgical procedure. The patient expresses concerns about post-surgical pain and asks what measures will be taken to manage it. Which of the following is the most appropriate response to the patient's inquiry? A. You will not experience any pain after the surgery, as we will manage it completely with medications. B. The pain management will involve both medications and non-pharmacological strategies, and we will adjust the plan based on your needs. C. The pain is to be expected after surgery, and you should expect to manage it on your own without medication. D. Pain management will focus on medications only, as non-pharmacological strategies are not effective for surgical pain. Answer: B. Your pain management will involve both medications and non-pharmacological strategies, and we will adjust the plan based on your needs. Explanation. Effective pain management after surgery typically involves a combination of pharmacological and non-pharmacological strategies. Medications may include opioids, NSAIDs, or local anesthetics, while non-pharmacological strategies can include relaxation techniques, heat or therapy, and distraction methods. Option B provides a comprehensive and accurate explanation that acknowledges the need for individualized pain management. Option is misleading because some pain may still be present after surgery despite medication. Option C is incorrect because effective pain management often requires both pharmacological and non-pharmacological interventions. Option D is too narrow, as non-pharmacological strategies have been shown to be effective in managing surgical pain alongside medications. Question 11. A nurse is caring for a 60-year-old patient with chronic obstructive pulmonary disease, COPD, who is experiencing increased shortness of breath, wheezing, and a cough productive of thick yellow sputum. The patient is using supplemental oxygen at 2 Lmin via nasal cannula. The nurse notes that the patient's respiratory rate is 28 breaths per minute, and they are using accessory muscles to breathe. What is the most appropriate action for the nurse to take? A. Increase the oxygen flow rate to 4 Lmin to improve oxygenation. B. Administer prescribed bronchodilator and encourage the patient to cough and clear their airway. C. Assess the patient's oxygen saturation level and call the healthcare provider for further instructions. D. Place the patient in supine position to maximize lung expansion. Answer. B. Administer prescribed bronchodilator and encourage the patient to cough and clear their airway. Explanation. The patient is showing signs of an exacerbation of COPD with increased shortness of breath, wheezing, and a productive cough. Administering a bronchodilator can help open the airways, relieve the wheezing, and improve ventilation. Encouraging the patient to cough will help clear the mucus from the airways. Option is not appropriate because increasing the oxygen flow rate beyond what is prescribed could lead to oxygen toxicity or worsen respiratory drive in COPD patients. Option C is important, but immediate intervention with a bronchodilator and airway clearance should be prioritized. Option D is inappropriate as it may restrict the patient's ability to breathe effectively. Question 12. A nurse is caring for a 72-year-old male patient with heart failure who is receiving an intravenous infusion of furosemide, Lasix, to manage fluid retention. After 30 minutes of the infusion, the patient complains of feeling lightheaded and dizzy. The nurse notes that the patient's blood pressure is 90/60 Hg and his heart rate is 102 beats per minute. What is the most appropriate action for the nurse to take? A. Continue the infusion as prescribed, as these symptoms are common with diuretics. B. Stop the infusion and notify the healthcare provider for further instructions. C. Increase the infusion rate to correct the low blood pressure. D. Administer an oral potassium supplement to address potential hypokalemia. Answer. B. Stop the infusion and notify the healthcare provider for further instructions. Explanation. The patient is exhibiting signs of hypotension, which could be a side effect of the diuretic infusion. Furosemide can cause fluid and electrolyte imbalances, particularly low blood pressure. The nurse should stop the infusion and notify the healthcare provider to assess the patient and adjust the treatment plan as needed. Option is incorrect because continuing the infusion without intervention could worsen the patient's condition. Option C is incorrect as increasing the infusion rate could exacerbate the hypotension. Option D is not relevant at this time as the immediate concern is the patient's hypotension, not potassium levels. Question 13. A nurse is teaching a patient with type 1 diabetes about the signs and symptoms of hypoglycemia. The patient asks how to treat hypoglycemia when it occurs. Which of the following is the most appropriate response? A. You should take a dose of your rapid-acting insulin to quickly lower your blood sugar. B. You should consume 2 grams of fast-acting carbohydrates, such as glucose tablets or juice. C. You should wait until your blood sugar levels stabilize before treating the hypoglycemia. D. You should drink plenty of water to dilute the glucose in your blood and resolve the symptoms. Answer. B. You should consume 2 grams of fast-acting carbohydrates, such as glucose tablets or juice. Explanation. When hypoglycemia occurs, the first step is to treat it with 2 grams of fast-acting carbohydrates to quickly raise the blood sugar level. This can include glucose tablets, juice, or regular soda. Option is incorrect because insulin would lower blood sugar levels further exacerbating hypoglycemia. Option C is incorrect because prompt treatment is necessary to prevent further complications from low blood sugar. Option D is non-appropriate treatment for hypoglycemia as drinking water will not raise blood sugar levels. Question 14. A nurse is caring for a 50-year-old patient who has been diagnosed with a myocardial infarction and is receiving anticoagulation therapy with heparin. The patient is complaining of back pain and the nurse observes that the patient's urine is dark and reddish. What is the most appropriate action for the nurse to take? A. Increase the patient's fluid intake to flush out the medications. B. Stop the heparin infusion and notify the healthcare provider immediately. C. Administer an analgesic for the back pain. D. Monitor the patient's vital signs and continue with the current care plan. Answer. B. Stop the heparin infusion and notify the healthcare provider immediately. Explanation. The presence of dark, reddish urine suggests that the patient may be experiencing hematuria, which could indicate bleeding. Given that the patient is on anticoagulation therapy with heparin, it is essential to stop the heparin infusion immediately to prevent further bleeding and notify the healthcare provider for further evaluation. Option is not appropriate as increasing fluid intake may not resolve the underlying issue of potential bleeding. Option C does not address the underlying cause of the symptoms and may mask important signs of bleeding. Option D would be inadequate because hematuria could indicate a serious complication and immediate intervention is necessary. Question 15. A nurse is caring for a patient with cirrhosis who has developed ascites. The patient is receiving diuretic therapy to help manage the fluid retention. Which of the following assessments is most important for the nurse to prioritize in this patient? A. Monitoring the patient's blood pressure regularly. B. Checking the patient's weight daily to assess for fluid changes. C. Encouraging the patient to increase their potassium intake. D. Measuring the patient's intake and output to assess fluid balance. Answer. B. Checking the patient's weight daily to assess for fluid changes. Explanation. Daily weight measurement is a crucial part of monitoring fluid balance in patients with ascites. A sudden increase in weight can indicate fluid retention, while a decrease can suggest effective diuretic therapy. Option A. Monitoring blood pressure is important but not as immediately relevant as weight in managing fluid balance. Option C is not as directly related to the management of ascites, although potassium levels should be monitored with diuretic therapy. Option D is also important, but weight is a more sensitive indicator of fluid status. Question 16. A 45-year-old woman with a history of breast cancer presents to the clinic with new-onset shortness of breath and chest pain. The patient is recently post-surgical, having had a mastectomy. She is currently on tamoxifen therapy. What is the most important initial intervention? A. Instruct the patient to take a deep breath and rest for a few minutes. B. Administer an opioid analgesic to manage the pain. C. Call for emergency medical services and prepare for immediate evaluation. D. Encourage the patient to drink water and relax to reduce the shortness of breath. Answer. C. Call for emergency medical services and prepare for immediate evaluation. Explanation. New-onset shortness of breath and chest pain in a patient with a history of breast cancer raises concern for a potential life-threatening complication such as a pulmonary embolism or a cardiac event. The most important intervention is to call EMS immediately for evaluation and intervention. Option is not appropriate because the patient requires urgent medical attention. Option B is not suitable for a potential life-threatening situation and could delay necessary interventions. Option D could worsen the patient's condition by encouraging them to wait, which is unsafe. Question 17. A nurse is teaching a patient with osteoarthritis about the proper use of a cane for ambulation. The patient asks for guidance on how to use the cane effectively. What is the most appropriate instruction for the nurse to provide? A. Use the cane in the hand opposite your affected leg to provide support. B. Use the cane in the same hand as your affected leg to provide more stability. C. Keep the cane behind you at all times to avoid tripping over it. D. Use the cane with both hands to distribute the weight evenly. Answer A. Use the cane in the hand opposite your affected leg to provide support. Explanation. To provide the most effective support and maintain balance, the cane should be held in the hand opposite the affected leg. This allows the cane to support the body weight while the affected leg bears less weight. Option B is incorrect because using the cane on the same side as the affected leg would not provide adequate support. Option C is incorrect because the cane should be used in front of the body to aid with balance. Option D is incorrect because using both hands for the cane is not standard practice unless prescribed by a healthcare provider for specific reasons. Question 18. A nurse is assessing a patient with a history of alcohol abuse who presents with confusion, tremors, and diaphoresis. The patient is agitated and requests more alcohol. The nurse suspects that the patient is experiencing alcohol withdrawal. Which of the following interventions is most important for the nurse to implement immediately? A. Administer a benzodiazepine as prescribed to prevent seizures. B. Provide the patient with a small amount of alcohol to ease withdrawal symptoms. C. Offer the patient a high-protein snack to reduce cravings for alcohol. D. Reassure the patient that the symptoms will resolve without intervention. Answer A. Administer benzodiazepine as prescribed to prevent seizures. Explanation. Alcohol withdrawal can lead to serious complications, including seizures. Benzodiazepines are commonly prescribed to prevent withdrawal seizures and reduce agitation. Option B is incorrect because providing alcohol to a patient in withdrawal is not recommended and may worsen their condition. Option C is not appropriate as the immediate concern is managing withdrawal symptoms rather than addressing nutritional needs. Option D is not accurate because alcohol withdrawal can be dangerous and appropriate intervention is necessary to prevent complications. Question 19. A nurse is caring for a patient who has been newly diagnosed with type 2 diabetes mellitus. The patient is prescribed metformin and is learning about lifestyle modifications. Which of the following statements indicates that the patient understands the importance of dietary changes in managing their condition? A. I can eat as much as I want, as long as I take my medication. B. I should focus on eating a balanced diet with low carbohydrate and high fiber foods. C. I should avoid fruits and vegetables because they have too many sugars. D. I should eat all my carbohydrates at one time during the day to avoid blood sugar spikes. Answer B. I should focus on eating a balanced diet with low carbohydrate and high fiber foods. Explanation. A balanced diet that includes low carbohydrate and high fiber foods is important for managing blood sugar levels in type 2 diabetes. This type of diet helps maintain more stable blood glucose levels and provides essential nutrients. Option is incorrect because relying solely on medication without dietary changes is not effective in managing diabetes. Option C is incorrect because fruits and vegetables provide essential nutrients and fiber which can help control blood sugar. Option D is incorrect as spreading carbohydrate intake throughout the day is generally recommended to prevent large spikes in blood sugar. Question 20. The nurse is caring for a post-surgical patient who is recovering from abdominal surgery. The patient reports discomfort and asks for pain medication. The nurse checks the patient's vital signs and notes a blood pressure of 106 mmHg, heart rate of 95 beats per minute, and respiratory rate of 14 breaths per minute. The nurse is concerned about potential opioid-induced respiratory depression. Which of the following is the most appropriate action? A. Administer the pain medication as prescribed and monitor the patient closely. B. Withhold the medication and notify the healthcare provider for alternative pain management options. C. Increase the dose of the pain medication to ensure adequate pain relief. D. Provide the patient with a non-opioid analgesic instead of the prescribed opioid. Answer B. Withhold the medication and notify the healthcare provider for alternative pain management options. Explanation. The patient's blood pressure is on the lower side and the heart rate is elevated, which may indicate a risk for opioid-induced respiratory depression. It is important to withhold the medication and notify the healthcare provider to assess the patient's condition and consider alternative pain management strategies. Option is incorrect because administering the opioid without further evaluation could exacerbate the patient's condition. Option C is incorrect because increasing the opioid dose would increase the risk of respiratory depression. Option D is safer alternative as non-opioid pain management may be more appropriate in this situation. Question 21. A nurse is caring for a 45-year-old male patient who has been diagnosed with acute pancreatitis. The patient reports severe epigastric pain that radiates to his back. He is also experiencing nausea and vomiting. The nurse notes that the patient has a history of heavy alcohol use. What is the most important nursing intervention for this patient at this time? A. Administer pain medication as prescribed to relieve discomfort. B. Initiate intravenous Roman fluids and electrolytes to prevent dehydration. C. Encourage the patient to eat small, frequent meals to improve digestion. D. Prepare the patient for abdominal ultrasound to assess the pancreas. Answer: B. Initiate intravenous Roman fluids and electrolytes to prevent dehydration. Explanation: in acute pancreatitis, dehydration and electrolyte imbalances are common due to vomiting and decreased fluid intake. Roman fluids and electrolytes should be administered to maintain hydration and electrolyte balance. Pain management is important but secondary to addressing hydration needs. Option is valid but should follow fluid resuscitation. Option C is not appropriate, as the patient should refrain from eating until the acute episode is managed. Option D may be useful later, but is not the immediate priority. Question 22. A nurse is caring for a 70-year-old female patient with a history of hypertension and diabetes mellitus who presents with a sudden onset headache, blurred vision, and confusion. The patient is hypertensive with a blood pressure of 200/100 mmHg. What is the most likely diagnosis and what is the immediate action the nurse should take? A. The patient likely has a migraine headache. Provide pain medication as prescribed. B. The patient likely has hypertensive crisis. Administer antihypertensive medication and notify the healthcare provider. C. The patient likely has a stroke. Administer thrombolytics and call for a CAN. D. The patient likely has a seizure. Place the patient in a safe position and prepare for seizure medication. Answer: B. The patient likely has hypertensive crisis. Administer antihypertensive medication and notify the healthcare provider. Explanation: the patient's symptoms, headache, blurred vision, confusion, along with severely elevated blood pressure, 220/100 mmHg, suggest hypertensive crisis, which is medical emergency. The nurse should administer antihypertensive medication as prescribed and notify the healthcare provider immediately for further management. Option is incorrect because the symptoms are more suggestive of hypertensive crisis rather than a migraine. Option C is unlikely because the patient's presentation is not consistent with stroke. Option D is not appropriate because the patient is not experiencing seizure. Question 23. A nurse is caring for a 60-year-old male patient with a history of chronic kidney disease (CKD) who has been prescribed erythropoiesis-stimulating agents (ESAs) to manage anemia. The patient reports feeling fatigued, short of breath, and dizzy. The nurse notes that the patient's hemoglobin level is 12.5 grams total. What should the nurse consider before administering additional ESAs? A. The patient may be experiencing an overdose of ESAs, which can cause high hemoglobin levels and increase the risk of cardiovascular events. B. The patient may need additional iron supplementation to support red blood cell production. C. The patient's fatigue is unrelated to CKD and no changes to medication are needed. D. The patient should receive blood transfusion immediately to correct the anemia. Answer A. The patient may be experiencing an overdose of ESAs, which can cause high hemoglobin levels and increase the risk of cardiovascular events. Explanation: in patients with CKD, erythropoiesis-stimulating agents (ESAs) are used to treat anemia, but excessive use can lead to elevated hemoglobin levels, which may increase the risk of cardiovascular complications such as stroke or myocardial infarction. The nurse should the patient's current condition and consider the potential for overdose before administering more ESAs. Option B is incorrect as the hemoglobin level is already 12.5 grams still, and the issue appears to be related to ESA overdose rather than iron deficiency. Option C is incorrect as the patient's symptoms are likely related to the current treatment. Option D is incorrect as the hemoglobin level does not indicate the need for blood transfusion at this time. Question 24. A nurse is caring for a 45-year-old patient with a history of asthma who presents with wheezing, shortness of breath, and coughing. The patient reports using their rescue inhaler multiple times over the past 24 hours without significant relief. The nurse notes that the patient is in moderate respiratory distress and has an oxygen saturation of 90%. What is the priority intervention? A. Administer a short-acting beta agonist, SAVA, nebulizer treatment and assess for improvement. B. Administer a dose of oral corticosteroids to reduce inflammation in the airways. C. Call for a respiratory therapist to assist with the patient's care. D. Administer oxygen via nasal cannula to improve oxygen saturation levels. Answer A. Administer short-acting beta agonist, SABA nebulizer treatment and assess for improvement. Explanation: the patient is experiencing an asthma exacerbation with symptoms of wheezing, shortness of breath, an ineffective use of a rescue inhaler. The first step is to administer a short-acting beta agonist SABA nebulizer treatment to relieve bronchoconstriction and improve airflow. This will provide rapid relief of symptoms. Option B may be necessary later, but should follow the initial bronchodilation therapy. Option C is not necessary immediately, as the nurse can manage the situation with the SABA nebulizer. Option D is appropriate, but improving airflow with a bronchodilator is the priority in managing the acute exacerbation. Question 25. A nurse is caring for a 72-year-old female patient with a history of atrial fibrillation who is being treated with warfarin. The patient presents with a sudden onset of right-sided weakness, slurred speech, and confusion. The nurse suspects a stroke and immediately assesses the patient's international normalized ratio INR, which is 4.5. What is the priority intervention? A. Administer vitamin K to reverse the anticoagulant effect of warfarin. B. Call for a STAT CT scan of the brain to evaluate the presence of a hemorrhagic stroke. C. Withhold any further doses of warfarin and monitor the patient's neurological status. D. Administer thrombolytics to dissolve the clot and restore blood flow. Answer. B. Call for a STAT CT scan of the brain to evaluate the presence of a hemorrhagic stroke. Explanation. The patient's symptoms are suggestive of stroke, and the elevated INR of 4.5 indicates that the patient is at increased risk for bleeding. CT scan of the brain is the priority intervention to differentiate between ischemic and hemorrhagic stroke. In cases of hemorrhagic stroke, reversing anticoagulation therapy. Vitamin K may be necessary. Option is valid if the stroke is hemorrhagic, but the CT scan is needed first to confirm the diagnosis. Option C may be appropriate later, but the immediate need is for CT scan to assess for bleeding. Option D is incorrect, as thrombolytics are only indicated for ischemic stroke, not hemorrhagic stroke. Question 26. A nurse is caring for a post-operative patient who has undergone abdominal surgery and is receiving morphine for pain management. The patient's respiratory rate is 8 breaths per minute, and the nurse observes shallow breathing. What is the most appropriate action for the nurse to take? A. Administer naloxone, Narcan, to reverse the effects of morphine. B. Encourage the patient to take deep breaths to increase oxygen intake. C. Continue monitoring the patient and notify the healthcare provider after 30 minutes. D. Increase the morphine dose to manage the pain more effectively. Answer A. Administer naloxone, Narcan, to reverse the effects of morphine. Explanation. The patient's low respiratory rate and shallow breathing are signs of opioid-induced respiratory depression. Naloxone is an opioid antagonist that can reverse these effects and should be administered immediately to prevent further respiratory compromise. Option B is not sufficient to counteract the effects of opioid overdose. Option C is inappropriate, as the patient's respiratory rate is dangerously low and requires immediate intervention. Option D is dangerous, as increasing the opioid dose would exacerbate the respiratory depression. Question 27. A nurse is caring for a 30-year-old patient with newly diagnosed rheumatoid arthritis, RA. The patient is prescribed methotrexate as part of their treatment plan. The nurse provides education on the medication. Which of the following statements by the patient indicates the need for further teaching? A. I need to have my liver function tested regularly while taking this medication. B. I should avoid taking over-the-counter vitamins or supplements without consulting my doctor. C. This medication will cure my rheumatoid arthritis and prevent flare-ups. D. I should report any signs of infection, such as a fever or sore throat, to my healthcare provider. Answer. C. This medication will cure my rheumatoid arthritis and prevent flare-ups. Explanation. Methotrexate is used to manage symptoms of RA and reduce inflammation, but it does not cure the disease. The patient should be informed that the medication helps control symptoms and may reduce flare-ups, but will not eliminate the disease. Option A is correct because liver function tests are necessary due to the potential for liver toxicity. Option B is also correct, as some over-the-counter supplements can interact with methotrexate. Option D is correct because methotrexate can suppress the immune system, making the patient more susceptible to infections. Question 28. A nurse is caring for a 40-year-old female patient with a history of obesity and type 2 diabetes. The patient is being treated for diabetic retinopathy and asks about the role of blood glucose control in preventing further vision loss. Which of the following is the best response? A. Controlling blood glucose is important to prevent further damage to the blood vessels in the eyes, which can worsen retinopathy. B. As long as you maintain a healthy diet, your blood glucose levels will not affect your vision. C. There is no need to worry about your blood glucose levels. Retinopathy will progress regardless of treatment. D. Only patients with poorly controlled blood glucose experience complications such as retinopathy, so should not be concerned about your vision. Answer A. Controlling blood glucose is important to prevent further damage to the blood vessels in the eyes, which can worsen retinopathy. Explanation: diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina, and blood glucose control plays a significant role in preventing further damage. Maintaining stable blood glucose levels helps to slow the progression of retinopathy and reduce the risk of vision loss. Option B is incorrect because blood glucose management directly impacts the progression of diabetic retinopathy. Option C is incorrect as controlling blood glucose can prevent further complications. Option D is not accurate. Even well-controlled diabetes can still cause some level of retinopathy, so it's important for the patient to manage blood glucose levels carefully. Question 29. A nurse is caring for a 55-year-old patient who is recovering from a total hip replacement surgery. The patient is at risk for deep vein thrombus (DVT) due to limited mobility post-surgery. The nurse has implemented several interventions to prevent DVT. Which of the following actions is most important in preventing the development of? B. Encourage the patient to perform leg exercises to circulation. B. Administer pain medication to encourage the patient to mobilize more easily. C. Apply anti-embolism stockings as prescribed to promote venous return. D. Position the patient with the affected leg elevated to reduce swelling. Answer A. Encourage the patient to perform leg exercises to improve circulation. Explanation: encouraging the patient to perform leg exercises is essential to stimulate circulation and prevent stasis of blood in the lower extremities, which can lead to the development of the early mobilization, and frequent leg movements are crucial in reducing the risk of clot formation. Option B is valid for pain management but not the most effective intervention for DVT prevention. Option C is correct in some cases, but leg exercises are more directly related to preventing DVT. Option D is important for reducing swelling but not for preventing blood clots. Question 30. A nurse is caring for a 65-year-old male patient with a history of coronary artery disease (CAD) who has been prescribed atorvastatin Lipitor for cholesterol management. The patient asks the nurse about the purpose of this medication. What is the nurse's best response? A. This medication will lower your cholesterol levels, which can help reduce your risk of heart attack and stroke. B. Atorvastatin helps control blood pressure, which is important for heart health. C. This medication will help you lose weight and prevent further heart disease. D. Atorvastatin is used to treat high blood sugar and prevent diabetes-related complications. Answer A. This medication will lower your cholesterol levels, which can help reduce your risk of heart attack and stroke. Explanation: atorvastatin is a statin medication that works by lowering LDL cholesterol levels in the blood, which helps reduce the risk of atherosclerosis, heart attacks, and strokes. It is not used for blood pressure control. Option B. Weight loss. Option C. Or diabetes-related complications. Option D. Explanation of the medication's role in managing cholesterol is essential for patient understanding.